Yes. So understand, say I go rule this land because the Most High I come down.
A little something to uplift your spirit. Turn your radios all the way up. Roll your windows down.
Can't wear me down.
Yeah.
I'm moving on. You can dim my light. You can pray for my downfall every night. Yeah. See, this truth makes me high. I'm a rocket till I die. I take my wings and fly high. You can't wear me down. This lonely road is very long. I pray Yahweh keeps me strong. Cause with him there can be no wrong. You can't wear me down.
See, I could fall or drown in self-doubt, or stand on my feet and pull myself out. Yeah. If I was weak, I'd throw the towel in easily, or take a second look to see what life is teaching me. And embrace it boldly, no rush, I take it slowly. If I go off the path, then I pray he show me. I was blessed with talents, and I accept the challenge. Life's a tightrope walk, somehow I kept it balanced. And when they tried to wear me, I knew that y'all would spare me. I kept the law, I'm not sure that some of y'all could hear me. But I'm not surprised, failure is not advised. Can't walk a mile in my shoes, my man, they're not your size. Take these words and share it, go let your mother hear it. If he's down, hook a song can lift a brother's spirit. And to the precious sisters, music was made to lift us. Touch our spirit at times if it's based in scriptures. And never say that your hope is done. Your faith is built, every obstacle you overcome. Count your blessings, cause life is a precious gift. Praise to Yahweh and the greatest king that ever lived. Yahweh Shai.
See, this truth makes me high. I'm a rocket till I die. I take my wings and fly high. You can't wear me down. This lonely road is very long. I pray Yahweh keeps me strong. Cause with him there can be no wrong. You can't wear me down. Ooh, yeah. Wear me down.
What's going on? What's going on, family? Welcome to another Sunday afternoon class from the Lions of Israel. It's your brother, Priest Daniela, representing Lions of Israel, Maccabees TV, and I am joined with Sister Malika Benjamin, representing the same. All praise to the Most High. Shout out to everybody that's watching us on YouTube, on our YouTube platforms. Make sure you guys subscribe, hit the notification bell. That way you guys know every time that we're live. Shout out to Clubhouse. The link is at the top of the room if you guys want to come over and watch the PowerPoint. I don't want to hold you guys up. Without further ado, I'm going to give it over to Sister Malika and allow her to do her thing. All praise to the Most High.
Shalom, shalom, shalom. Welcome, welcome, welcome. Hopefully you guys are able to hear me. As always, I like to ask that question. Hopefully you guys are able to hear me. All right. Welcome and shout out to everybody who's watching. Shout out to Harajuku. Don't know who that is, but shout out to you. Shout out to Rama Jama. Shout out to everybody. Welcome again to another episode of health and wellness discussion. All right. Let's get to it. So as always, I'm going to share my screen. If you give me a second there, let me set it up. All right. And as you guys know, when I come here every week, I usually like to discuss topics that sometimes people ask me to talk about. Sometimes it's conversation I've had with people that are dealing with medical issues, and I like to talk about those issues so that other people can learn from it, and take something away from what somebody else might be going through. All right, so hit the like button. If you're in the room, hit the like button and share the lesson today. Maybe you can help somebody by sharing this link to your friends and family. All right, share it with someone. Okay, all right. So based on some conversation I've had, this is going to be the topic today. So the topic is what's hidden inside your home that's making you sick. Like I said, this topic was inspired by a conversation I had with people. All right. We're at the time of year where a lot of cold and flu and cough and respiratory issues going on. Hopefully none of you guys watching are dealing with this stuff. Okay. All right. Whoops. Okay. So as always, I always like to make a note so that I don't forget. So before I go further, the reason I have that up on the screen is because I have a question from a brother, and I like to make a note just so I don't remember the questions that people ask me. And so that's why I have that up on the screen. And so someone asked that question, a question. And if you guys give me 1 second, let me look for it here. The question was, I want to know. Oh, okay. So a brother wants to know if so I have talked about a formula for circulation and erectile dysfunction. So a brother wants to know if the circulation formula really helped with erectile dysfunction. That's what he wanted to. That's what he was asking. Okay. So I thought that was a very important question, and I wanted to talk briefly about that today before I continue. So let me say this, right? There are different reasons why a man might be having issues with erectile dysfunction. Okay. And I'm going to go through a few of them here before we move on. Okay. So if your erectile dysfunction is coming from a psychological issue, because that could be one of the issues. Okay. It could be psychological. Okay. Where I'm going to give you guys an example. I met a gentleman last year, and the gentleman was asking me for some herbal medicine for erectile dysfunction. And I asked him, I said, do you know what's causing it? And he says, well, every time he would be in the presence of a particular lady, he would get very nervous and very shy. And he can't figure out why, right? There's nothing wrong with the gentleman. He's just nervous whenever he get around this lady. So he's not necessarily having a medical issue. That's nervousness. That's all in his head. You know what I mean? So it's not something I can help you with. Like, I can't just give you some herbs and help you get rid of your nervousness. I mean, that's something I'd have to talk to, maybe a therapist about. Something is, that's you're shy, you're nervous. So that could be cause, right? So that's what I like to call a psychological problem, right? Now, It could be a neurological problem. It could be neurological, right? So for example, if you've had, say, a prostate surgery, a surgery on your prostate, right? And the doctor caused some type of nerve damage during the surgery, right? They damaged the nerves. And as a result of that, now you're having issues with your, with your member, right? So that's what I like to call medical malpractice, okay? Because that's something that happened in the middle of a surgery, right? Let's say you have some type of issue with the spinal cord, you have spinal cord injury. You understand? Your brain sends signal to every part of your body, including your lower extremities, right? So, if you're having issues with certain illness that deals with brain function and spinal issues, then that can also lead to that type of issues downstairs, right? Now, as to the question that the brother asked me, does the formula help with erectile dysfunction? Well, if the erectile dysfunction is a result of poor circulation, then yes, the herb formula will help with that, okay? So as I mentioned, there are different reasons a man can be having issues with that type of issues, okay? So I hope I was able to kind of clarify some things. So if you're having poor circulation, you can definitely clear that up. Hang on. Give me 1 second. Give me 1 second, guys. Hang on a minute. So right here, is the circulation formula, right? And this is a formula for poor circulation. This formula right here, if Anne is having issues with ED as a result of poor circulation, this is a formula that will help him get rid of it, okay? Poor circulation is when you're having issues in the arteries, in the blood vessels, okay, that is causing the flow, your blood flow not to flow properly, okay, which means also that you are at risk for a stroke or a heart attack, all right? And your erectile dysfunction is a symptom of a bigger problem, all right? So if you're dealing with ED, you need to first find out where that's coming from. Are you just shy or nervous? Did you have surgery at some point? Did you have some type of medical malpractice performed on you? Because that's what they're doing in these hospitals nowadays. They're messing people up, right? Or if you've never had surgery, you're not shy, right? Then more than likely you're having issues with poor circulation. And just so you know, one of the biggest cause of erectile dysfunction, especially in Black men, is poor circulation because of all the issues with the diet, the diabetes and all this heart issues that the Black community have. That's the biggest cause of erectile dysfunction, is poor circulation. All right. So yes, this will definitely help with erectile dysfunction if you are dealing with poor circulation. All right. So I just wanted to clarify that before we move on. Okay. All right. Okay. So today, I want to talk about issues that people are having, maybe having in the home, don't know that they're having these issues in the home. All right. It could be with a child or an adult. Somebody in the home is having issues with a lot of respiratory issue, coughing, just coughing, dry cough, a lot of mucus. You don't know where this stuff is coming from. So what are a list of reasons why people have long-term persistent chronic cough and lots of mucus and inflammation? All right. So today we're going to address some of the things. So asthma is one reason that people have a lot of coughing. Postnasal drip, acid reflux or GERD, COPD, the flu or pertussis or pneumonia, lung cancer, environmental irritants and allergies. All right. And we're going to deal with some of those. So let's start with asthma. Asthma is a chronic respiratory condition that is triggered by many different things. Okay. It could be by the food you eat, pets, the environment, mold, dust mite, etc., etc., etc. Right. Some children are born with asthma because the environment in which they were conceived were unhealthy. What do I mean by that? The mother's womb was not a healthy environment when she conceived and carried that baby for 9 months. And that's why children are born with asthma. Okay, another reason, hopefully this doesn't get this video taken down from YouTube. Childhood vaccination will contribute to respiratory condition. They don't tell you that. I'm telling you that. Okay. Okay. There are things that can trigger an asthma attack and other respiratory condition like chronic coughing. Can mold cause respiratory problem? Even if you don't have asthma, here is how mold can trigger chronic coughing in both you and your children. Mold releases tiny spores in the air. When you inhale them, they can irritate the lining of the throat. This irritation triggers reflex coughing as the body tries to clear the particles and get rid of this foreign object. After you inhale mold, your airway becomes swollen and sensitive. This will trigger your body to produce a lot of mucus to protect itself. That's what the body does. Whenever a foreign object enters your body, the body will immediately start producing a whole lot of mucus to protect the lining of the stomach. If you ever wonder why when you walk into a building and it's dusty and moldy, you start to sneeze, that's your body trying to get rid of the stuff you're inhaling. And then start to get runny, that's your body start to produce mucus to protect your nostril, to protect that stuff from going into your nostril. So that mucus is like a protective barrier, right? And then over time, you start to feel that mucus in your throat because your body is trying to stop that stuff from going down your throat. So it's that mucus again is like a protective barrier trying to stop that stuff from going inside your body. So that's what the body does. It produces excess mucus to protect itself, right? So the cough receptor in your body will become hypersensitive, and this will cause you to have persistent coughing. For people with asthma, if you inhale mold, this will cause your airways to become tightened. Your body will also begin to make a lot of mucus, and then you'll start to have a lot of inflammation. Irritation causes inflammation, okay? Anything that's irritating you, you're going to get a lot of inflammation. So this leads to coughing, wheezing, tightness in the chest, and shortness of breath, all right? Mold can also lead to that, that persistent dry cough that goes on and on and on for weeks and sometimes months. Yes. Now, where can you find mold in the house? Pretty much anywhere. in the house the mold can be, okay? Behind the fridge, all right? Maybe you have some moisture build up underneath or behind your refrigerator, all right? There could be mold back there and you don't even know it. Maybe you need to check behind your fridge. Behind your couch. People spend a lot of time on their couch, eating and drinking, and the kids are playing and dogs and the cats are knocking stuff over, whatever. You never know. Maybe some liquid, some water, juice, somebody done knock something over and it was wet, and next thing you know, there's mold start to build up underneath that, behind the couch or somewhere, right? Beneath the carpet or somewhere, right? That can bring mold. Inside the closet, right? Underneath the carpet. Again, some leak or something spill or whatever, Maybe you have children in the home or pets or whatever. All right. But this might be a reason for your constant coughing. If you have had asthma, this might be the reason for your asthma. Okay. Carpet harbor a lot of these things, dust mites and all of this stuff. All right. So if you have a child in the home and that child is struggling with asthma, you may want to look into these things. Make sure you don't have mold. I've seen children being rushed to and from the hospital and they can't figure out what's wrong. There's a possibility that you may have mold in your home. Okay. Mold on the window panels. Check your windows. Certain weather conditions may cause condensation in your windows and will, mold will build up there. All right. There's a reason I'm showing these images, because these things happen. If you have a basement, you might have mold in your basement. You have a water heater somewhere in the house. You might have mold building up back there. And like I said, they're mold spores. You can't see them, but they're in the air and you're breathing them in. All right. Let's talk about postnasal drip. Postnasal drip is mucus from your nose or your sinus that drips to the back of your throat and make you cough. You ever feel that little thing going down the back of your, that's what you call postnasal drip. This could be a result of mold in the environment. It could be a result of a lot of things. It could be mold, dust mite, whatever, right? But it could be, inhaling harmful chemicals, smoking, dust, all of that stuff, right? But it could also be excessive, the foods that creates a lot of mucus in your body as well. That's one of the things that I talk about a lot. What I like to call the inflammatory foods, the foods that cause the body to create lots of mucus, right? Like the milk, the cow's milk, the cheese, this stuff that you eat, the bread, the pancake, the pastries, the excessive fried food and fast food, pizza and all that stuff. Those are things that cause your body to react and produce excess mucus to protect itself from all of this acidic, because all of that stuff that I just named just now, those are all acidic foods. And your body produces a lot of mucus to protect itself from all of that acidity that you're putting in the body. All right. Acid reflux or stomach acid from acid reflux can irritate the throat and cause mucus overproduction, which will make you cough. All right. This lesson is not going to be too long today, guys, so I'm not going to keep you guys too long. Acid reflux is mainly caused by the diet you are maintaining, okay? The type of foods you choose to eat and how you choose to eat your food. Like coffee, soda, red meat, tomato sauce, tomato paste, tomato ketchup, processed grain, cheese, yogurts, eggs. alcohol, pizza, pasta sauce, food with vinegar. All of these foods are acidic and they are low on the pH scale. These foods create lots of acidity, mucus, and inflammation in the gastrointestinal system, right? I'm not saying you can't enjoy these types of food every now and then, guys. That is not what I'm saying. What I'm saying is a lot of people overindulge in the foods. We must have them excessively all the time, every day, as soon as we wake up, all day long. We must have these foods. And that's why we're sick. Because we're overindulging, we're oversaturating our bodies with these acidic foods. That's causing our bodies to produce excessive mucus, and in turn causing a lot of inflammation in our bodies. You know, the brother who passed away, Dr. Sebi, if I'm not mistaken, he talks a lot about this stuff. He talks a lot about the acidic foods and, you know, the pH and all of this food that has low pH, right? A lot of people listen to him, but I don't know if anybody is you know, this is, I mean, the brother was right. He was right, wasn't there? A lot of us have been telling you all this for years. Dr. Sebi was not the only one, okay? I mean, he happened to have been famous. All of us are not famous, but we were all trying to tell you the same thing. Okay, I've been trying to tell you all this for a long time. These foods, these processed food, we're not telling you that you can have a little whatever every now and then, but it's really the excess every day, all day long, 7 days a week. We overindulge in these things, and that's why we are sick. It's contributing to our sickness, okay? When was the last time you have a healthy bowl of homemade soup? I want you to ponder on that. When was the last time you stay home and made yourself a healthy bowl of homemade soups with lots of vegetable and what we call back home ground provision? Okay. Dust mite. That's what you're looking at there on the left. Dust mite. Dust mites live in your home, unfortunately. I hate to be the bearer of bad news. They live in your home. When you inhale dust mite allergens, yes, we do inhale them, your immune system reacts, and the lining of your airways swells up. Your body immediately begins to produce, again, excess mucus to protect itself, and your throat and nasal passage become irritated. This is for the people who are allergic to these things. Some people are not, okay? Some people are able to, inhale these things and they're fine. I'm talking to people who are constantly coughing and, allergic to these things, all right? This leads to stuffy runny nose, sneezing, congestion, itchy, watery eye, post-nasal drip, and coughing, and so on and so forth. Dust might also trigger asthma attack, okay? Dust mite will worsen the chronic inflammation in the airways. It increases sensitivity and hyperreactivity of the lung, which cause wheezing, tightness in your chest, and shortness of breath. If you do not get rid of these dust mite, this can lead to long-term chronic sinus inflammation, persistent coughing. Your asthma symptom will worsen and get out of control, and you will eventually have reduced lung function. All right? That's very important. So where do dust mites live? I know somebody is asking that. Where do dust mites live? On your curtains, if you don't wash them properly or wash them often. On your children's stuffed animals, if you don't wash them often. Those cute little stuffed animals that your babies are always sniffing, and yeah, that's where them dust mites are. On your carpets and rugs, if you don't clean them properly. On your couch, if you don't clean it properly. Steam it. On your bed linen, if you don't wash them often. In your closet, and the mold is also in your closet. And pretty much anywhere in the house that they can attach themselves to. Okay, so if you're dealing with any of these respiratory issues, or if you have a child in the home who's dealing with these issues, you should consider investing in one of these, these machines right here, okay? The first one is the air purifier, okay? An air purifier will eliminate environmental toxins from the environment. It purifies the air by using a fan to pull the air through a series of filters that trap or neutralize pollutants like dust, pollen, mold, spores, bacteria, and odor. It then releases the purified air back into the room, but make sure you are changing or cleaning the filters often. All right. If you have these in the home, make sure you're, some of them you have to change the filter, and some of them you don't have to change the filter, you just clean the filter. All right. A dehumidifier. A dehumidifier removes excess moisture from the air, which helps prevent problems like mold, mildew, and musty odor. And this is very important because, again, a lot of parents are dealing with children or a child in the home that are going through hell with asthma and respiratory problem, and also eczema as well. These issues also affect eczema. Those are all allergies. Adding a magnesium in your daily supplement can improve your cardiovascular system and help to relax the airway, help you breathe, right? I personally recommend a liquid or capsule, magnesium glycinate, all right? Hang on, guys. Of course, you can get your magnesium from anywhere. I'm just showing you where you can get one, a glycinate, if you, in case you're wondering. Here on the website, Grassroot Botanicals, there's a magnesium glycinate right there. All right. Let's continue. Okay. So we're switching gears. We're going to talk about something else. This topic is also something that someone called me about. How infected tooth or teeth affect your gut. This conversation, I don't even remember if I've ever seen anyone talking about this conversation here online at all. I don't see anybody discussing this, but this is a real issue that's happening. I'm going to talk about it today. Okay. A persistent or long tooth infection can cause chronic inflammation in your gut. How many of you guys knew that? A tooth infection can cause infection in your gut. If you have a tooth in your mouth and your gum is raw and your gum is constantly bleeding, you more than likely have an infection in your mouth, and this is going to cause issue in your gut. Okay? Every time you swallow, you are swallowing bacteria from that infected tooth. And that bacteria travels to your gut and colonize your gut. Bacteria they multiply, just so you know. They multiply. So they go down, you every time you swallow, if you have a bacteria, an infection in your mouth from a tooth, an infected tooth, every time you swallow, you're swallowing that bacteria. And that bacteria is traveling to your gut and it's colonizing your gut. This is going to interrupt the microbiome in your gut. It's also going to affect digestion and nutrient absorption, okay, which means it's going to be harder for your body to absorb nutrients from the foods you're eating, all right? This can also cause bloating, irregular bowel movements, and it can also disrupt your immune system and weaken your immune system, okay? So when you have an infected tooth, you're unable to chew your food properly, which means also that your digestive system is not properly digesting your food, which is also going to lead to digestive illnesses as well, all right? This disruption of the digestive system can lead to long-term chronic inflammation, which can lead to other serious illnesses. All right. If you have an infected tooth and you have medical insurance, you need to see a doctor. See a dentist. Okay. All right. See a dentist. Hang on.
Did you know that dental infections can spread to the body? Hello, everyone. Have you ever wondered if dental infections can spread to other parts of the body? In this video, we will tell you everything you need to know about dental infections, their causes, symptoms, and consequences. Many people don't pay enough attention to dental infections. However, they can be dangerous and even deadly if not treated early. So pay attention and learn how to identify a dental infection and prevent serious future complications. Let's start with the most important question. What is a dental infection? In short, dental infections are a process in which pathogenic microorganisms, such as bacteria, viruses, or fungi colonize living tissue. In the advanced state, an accumulation of pus occurs, known as a dental abscess. Before an abscess occurs, dental infections can be almost imperceptible since most of the time they are asymptomatic. However, depending upon the origin of the infection, dental abscesses can be seen in different parts of the mouth, such as the gums, the roots of the teeth, or the jaw. Why do dental infections occur? What are their symptoms? The buildup of bacteria that cause dental infections occur for a number of reasons, including advanced tooth decay, gum disease, wisdom teeth, dental trauma, or inflammation of the dental nerve. Tooth decay is caused by acid produced by bacteria in the mouth. This acid destroys the hard tissues of the tooth, such as enamel and dentin. If a cavity is not treated in time, it can progress and affect the dental nerve, which then causes intense pain, swelling of the face, and sensitivity to acid, sweets, cold, and gum diseases, known as gingivitis and periodontitis, meant when there is an accumulation of plaque or tartar in the space between the gum and the tooth. This condition causes inflammation, and if not treated in time, it becomes an infection that produces an abscess at the gum level. The infection that occurs in the wisdom teeth is called pericoronitis and occurs when bacteria or food debris is introduced into the gum that covers these teeth in the process of eruption. This causes pain, redness, suppuration of the gum, swelling of the face, and dental sensitivity. Dental trauma, such as blows or falls, can also affect the teeth and cause fractures or the death of the dental nerve, thereby increasing the risk of infection. In these cases, it is advisable to go to the dentist as soon as possible. What happens if a dental infection spreads to the body? Many people don't realize how serious a dental infection can be, believing it to be a minor problem that can resolve itself. However, this is not true. If a dental infection is not treated in time, it can spread to other parts of the body and cause serious complications. When a dental infection spreads, the bacteria can enter the bloodstream and affect other body organs. For example, bacteria can reach the heart and cause endocarditis, the inflammation of the heart's inner lining. They can also cause brain abscesses, pneumonia, and other serious illnesses.
That's the part I want you guys to pay attention to. Do y'all see how one tiny little problem can lead to other big problem? I mean, we're talking about an infection in your mouth from a tooth decay or tooth infection can lead to big issues like heart issue. I'm going to run that back again. Let's run it back.
Enter the bloodstream and affect other body organs. Bacteria can reach the heart and cause endocarditis, the inflammation of the heart's inner lining. They can also cause brain abscesses, pneumonia, and other serious illnesses. How do you know if a dental infection has spread to the body? It is important to watch for some dental infection that has spread to the body. Some of the common symptoms include high fever, severe headache, pain in the neck and jaw, difficulty to swallow, difficulty breathing, fatigue and weakness, nausea and vomiting, confusion and behavior changes. If you experience any of these symptoms, it is important to seek medical attention immediately. Early treatment is essential to prevent serious complications. How to prevent dental infections. Good oral hygiene is the key to preventing dental infections. Here are some tips that can help. Brush your teeth at least twice a day with toothpaste containing fluoride. Floss daily to remove plaque and food debris between teeth. Use mouthwash regularly to reduce the number of bacteria in your mouth. Limit your intake of sugary foods and drinks. Visit the dentist regularly for checkups and dental cleanings. In conclusion, it is essential to pay attention to dental infections and seek early treatment to avoid serious complications.
All right.
Good.
Okay. Now I'm going to tell you, I'm going to share some homemade, well, not homemade, some home practices. Okay. For those of you who don't have, say, medical or dental insurance, right, to go see a dentist often, right? There are things you can do at home to keep your teeth and your gum and your dental hygiene, free of infection and so on and so forth, right? So if you don't have medical insurance and you are dealing with some type of infection in the mouth or a bad tooth in the mouth, or even if you don't have any of those things, but you want to keep good dental hygiene, okay? But I'm talking to the people specifically who are dealing with a rotting tooth or some type of thing going on in their mouth. I would say go on a vegetable juice fast for at least 24 to 48 hours. For those of you who are dealing with an immediate problem, okay? This is for everybody. But if you're dealing with an immediate problem where you have an infection in the mouth, you don't have the money to go to the doctor, I'm trying to give you a solution. I tell you guys, whenever I come here, I try to give solution, okay? Go on a vegetable juice fast for 24 to 48 hours. then you're going to use clove essential oil on your tooth to get rid of the infection. Yes, clove oil. Clove oil will penetrate the area where the tooth is, the gum, and get to the source of the infection. All right? That clove oil will get rid of that infection. Okay? But you must maintain proper dental hygiene afterwards, guys. Every day you gotta, gargle also with the clove oil water several times a day. All right? Gargle with it. Hang on.
Let's talk about dosage amounts for anything with a dropper. What's a dropper? This is a dropper.
I'm showing you guys how. Well, let me go back. Okay, so this is clove oil right here. All right, we're gonna take it easy and show you guys. This is clove oil. Some brothers don't know what clove oil is. How do I know this? Because I had a brother who had a horrible toothache, and I told him to put some clove oil on his tooth, and he had no idea what clove oil was. Okay, and that's why I'm taking you to show you what clove oil is, or where it is. Clove is a spice. It's a natural spice, very strong, and it is antibacterial. Give me 1 second. Here we go. Moving a little slow. So here we go. We are on the website again, Grassroot Botanicals. We're here, Grassroot Botanicals. And here is the clove oil. Okay. This is liquid. It is very, very strong. You don't need a lot of this. And so I'm going to allow the young lady here to explain to you how to use that. All right. Let her show you how to use it.
Let's talk about dosage amounts for anything with a dropper. What's a dropper? This is the top is easy to squeeze. And when you put it inside the liquid, you're going to squeeze it and then release that tension. And the liquid is going to be drawn into the glass part of the dropper. So onto the dosage. We're going to look at the directions, and this says 1 to 4 drops. I'm going to use 4 drops as the example. What you're not going to do is fill it up and then squeeze it until it's empty and consider that 1 drop. That is 1 dropper. Okay? 1 drop is squeezing it, filling it up, and then 1, 2, 3, 4. And you really don't even have to squeeze it because it just really starts to just drip out. Just a little bit thicker of a liquid. Then you're going to squeeze it very gently and get 4 drops. You're not filling it up and then emptying it out and considering that 1 drop. Okay? You're doing drip, 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 drip. Okay? What else?
All right. Thank you, sister. So just wanted to show you how to use the dropper bottle there. That's the best one to use. Now, a lot of people tell me, oh, when they have a toothache, they try to chew on the clove itself. Here's why this is not entirely effective. Okay, it might help a little, but this is not really effective. Because number one, if you're having toothache, you could barely chew anything. So I don't see how you're chewing on cloves. But the reason the oil is recommended for a tooth infection and toothache is because the oil is a liquid, and liquid penetrates the gum and go directly to the root of the tooth and eliminate the infection faster. Okay? That's why you need the oil. The oil is a liquid, and once you pour it on the area where that infection is, it's penetrating the gum and it's going all the way down there, and it's rooting out that infection faster. So that's why you need the oil. All right. So if you're sitting at work and you're having a bad toothache, you better have clove oil in your bag or in your pocket or somewhere in your purse, because that's gonna help you out. Trust me. Now, this is something that I personally do on a regular basis. Gargle with clove water. Okay. So what I do is I take about a mouthful of water, room temperature, and I put about 5 or 6 drops of clove oil in that water. I shake it around a little bit and I put it in my mouth. I put the water in my mouth and I gargle with it and I swish it around in my mouth, right? And then I spit it out. Do not swallow. Okay. You do not want to swallow clove oil. Did I remember to say that? I'm saying it now. You do not want to swallow clove oil, okay? It's very potent. It's very strong, but it is one of the best oil. It's antibacterial, antifungal, anti-inflammatory. It gets rid of bacteria, all right? But you don't want to swallow it. Now, personally, I know how to use it effectively. I can, I know the right amount of dosage. If I a little bit of clove oil and swallow it, I can do so. But if you don't know how to use it, I wouldn't recommend that you try it at home. Okay. Just going to leave that there. Now, like I said, you switch it around in your mouth, you gargle with it, and then you spit it out. You can repeat this 2 to 3 times a day or 3 to 4 times a day, especially if you have infection in your mouth. Okay. This will eliminate bad breath. And it will also prevent future tooth or gum infection, okay? So you should probably make this a part of your daily routine, is what I'm trying to tell you guys, to have healthy gum. We don't really have these conversations very often, do we, right? These are very important conversations to have, right? A lot of people don't know about this stuff. They might seem, minute, but they're important because a lot of people are struggling with tooth decay and tooth infection and tooth pain and don't know what to do. They're sitting there in pain and don't know what to do because they don't have the money to go to the dentist. And that's why I'm sharing this information. Okay. All right. How do I get rid of bacteria from my gut naturally? If you've had a tooth infection and you've been dealing with it for a while and now you have bacteria in the gut, because you do. If you've had an infected tooth, you have bad bacteria in the gut. Okay. Now you can either get on some antibiotics or you can take a natural parasite cleanse. The choice is yours. A parasite cleanse get rid of the bad bacteria naturally without any side effects. And it also helps to balance the microbiome in your gut and to help you balance the pH levels in your gut. Also take a probiotics. All right. That's very important. Better than that antibiotic that's going to mess up your gut. I'm sharing my screen again. We're back on the website, Grassroot Botanicals, and I'm showing you the parasite formula here. If you have bacteria in the gut, I know I've been beating you guys over the head with this, but this is very important. This is going to help you to get rid of bacteria in your gut, okay? However, me personally, I like to drink bitter tea because bitter tea also helps to get rid of bacteria from the mouth, okay? But when you're taking something like this, a parasite formula like this, you want to eliminate sugary stuff. Like that lady said in the video earlier, you want to eliminate sweet, sugary stuff, your juice and sodas and all that stuff when you're taking stuff like this, because you're trying to get rid of bacteria, and all of that sweet, sugary stuff attracts bacteria. Okay. So you want to get rid of bacteria. You want to eliminate those things while you're taking a parasite cleanse. Okay. That's very important. All right. I think we've gotten to the end of our I told you guys I wasn't going to keep y'all too long today. Told you I wasn't going to keep you too long today. We're at the end of our health and wellness lesson today. If you guys have any questions for me, put it in the chat and I will respond to it. Yeah, today was a short one, guys. Today was a short one. Any questions for me before I go? Shalom, Sister Kelly. Shalom. Arajuku says the clove will work really fast and it's strong. Absolutely. Absolutely, sis. Absolutely. Fluoride. Yeah, I don't really use, I know they said that in the video, but no, I don't use that type of toothpaste at all. All right. I'm just reading your comments here. Anyone have a question for me before I go? Thank you, Sandy, Sister Sandy. Thank you. All right. So I guess you guys don't have any questions for me. Let me see. Let me go back and before I go, hold on. Hang on. Let me look at the other chat. Let me look at the other chat. All right. Give me 1 second, guys. Give me 1 second. All right, guys. Thank you for coming in. Thanks for coming in, and we'll see you guys next week. All right. All righty.
All right. All praise to the Most High, guys. We'll be here again next week. If it be the Most High's will. We appreciate you, brothers and sisters, for being here. And with that, we say shalom.